Medical Research and Patient Privacy by Kristyn Connor. Some people may be concerned about their privacy when it comes to medical research, and they have every right to be. When it comes to medical research, you may not be aware of procedures that should be followed in order to keep your information private, but this slideshow will explain further why some people are concerned about their privacy as far as medical research goes and what procedures should be followed to keep patients' information private. An article by Kristyn Connor states that some commercially sponsored research can actually be marketing that has been disguised, but that patients should still be concerned about their privacy with this type of research. Not all patients are protected under privacy rules when it comes to medical research. Research that requires a treatment or access to protected health information is protected by privacy laws, but not all research requires access to protected health information or treatment, so that leaves room for a breach of someone's privacy. Under the Health Insurance Portability and Accountability Act of 1996, which is also known as HIPAA, subjects of medical research will be able to feel more confident that their private information will be kept private. Subjects of medical research will be notified of privacy practices and will also be required to give consent to their information being used or released. In addition to researchers receiving informed consent from patients, they will be required to obtain a waiver of authorization to use or disclose a patient's personal information, according to an article by Kristyn Connor. While it may seem that procedures to keep information private are a long and unnecessary process, it is very important to always receive consent to use a patient's medical information because it is very private. It is also important that patients fully understand privacy policies to avoid any accidental breach of privacy that could result in the embarrassment of the patient and fines or termination of the doctor or researcher. On the other hand, people may be less likely to participate in research studies, according to an article by McCarthy, Shatton, Dinkard, Kleinman, and Gardner, which states that patients may also be concerned that participating in studies because they do not want information being released to their insurance companies or to other sources that could have deteriorating effects on the patient. For example, someone who suffered from a seizure may have concern about losing driving privileges as a result of medical information being made public. Thank you for listening, and I hope that you now feel safer when it comes to your personal information and medical research. For more information on this topic, please visit privacyruleandresearch.gov for an article on how HIPAA affects clinical medical research.